This is Dr. Ben Weitz with the Rational Wellness Podcast, bringing you the cutting-edge information on health and nutrition from the latest scientific research and by interviewing the top experts in the field. Please subscribe to the Rational Wellness Podcast on iTunes and YouTube, and sign up for my free ebook on my website by going to drweitz.com. Let's get started on your road to better health. Hello, Rational Wellness Podcasters. Thank you so much for joining me again today. For those of you who enjoy the Rational Wellness Podcast, please go to iTunes and leave us a ratings and review, and subscribe to our YouTube channel, which is Rational Wellness or Weitz Chiro. Our topic for today is Polycystic Ovarian Syndrome, PCOS. This is actually the most common hormonal disorder among women between the ages of 19 and 44, affecting up to 20% of women in this age group, depending upon how it is defined. And it's also one of the leading causes of infertility. According to the Rotterdam Consensus, PCOS is present if 2 out of the following 3 criteria are present. Number 1 is delayed ovulation or menstrual cycles, known as anovulation. Basically, if your cycle lasts 35 days or longer, that qualifies for this. Number 2 is high levels of androgenic hormones like testosterone and DHEA. And 3, polycystic ovaries seen on ultrasound. Besides irregular periods, the following symptoms are often associated with PCOS: weight gain and difficulty losing weight, fatigue, facial hair and nail pattern baldness in women, acne, infertility, mood swings, pelvic pain, headaches, and sleep problems. Here to help sort things out for us with PCOS is Dr. Fiona McCulloch. She's a naturopathic doctor and the founder of White Lotus Integrative Medicine in Toronto, Canada, serving thousands of women with hormonal conditions. Dr. Fiona wrote a book, 8 Steps to Your PCS, which offers well-researched methods for the natural treatment of polycystic ovarian syndrome. Fiona also developed a nutritional methodology for the open source health PCOS project, which analyzes molecular, genetic, metabolic, and hormonal markers in women with PCOS. Thank you for joining me, Dr. Fiona McCulloch. Would you rather me call you Dr. Fiona or Dr. McCulloch?
Oh, you can just call me Fiona. It's great to be here on the show.
Excellent. So how did you come to be so interested in polycystic ovarian syndrome?
Well, I do actually have this condition myself. And so because of that, I went through many, many years of not being diagnosed with this and not knowing what was wrong. So as I went into practice, I became more and more interested in different kinds of hormonal issues. I just always found hormones really fascinating. And so obviously having these issues myself, I became more and more interested. And it's such a misunderstood condition. So I love unraveling different mysteries and help solving problems. So I guess it just was really, really fascinating to me.
Yeah, that's great. That's one of the things that attracts me to functional medicine as well, is solving the mystery of the person and peeling back the layers of the onion till you can help them achieve better health. Why is PCOS seemingly such an epidemic today?
So it's something that's that's actually quite an interesting question. So we know that it's been around for a long time because even in ancient medical textbooks, there was mention, there were these symptoms of PCOS that were mentioned, but it does seem to be on the rise. And what we know now is that it's a combination of genetic predisposition along with something that from the environment that turns it on. So for example, we know that certain endocrine disrupting chemicals can cause PCOS. If a woman is exposed to those while she's pregnant, it can cause PCOS in the offspring. So we know that's definitely a big part of things. The other interesting components are that most women with PCOS have insulin resistance, which means, higher levels of insulin, and it's much easier to gain weight. And our food these days is actually often quite aggravating to that. And with insulin resistance, the more insulin resistant you get, the worse the PCOS gets. So it also makes the condition itself worse. And so we see more of it in medical practice because of that.
Interesting. You mentioned the endocrine disrupting substances, and in your book, you talk about the connection with BPA as being directly correlated with PCOS. And, one thing I find really interesting is these endocrine disrupting substances, like plastics and BPA, and there's a whole bunch of others, pesticides, we often think of as estrogenic. And I just think it's so interesting that in men, these substances often reduce testosterone levels, whereas in women, they're increasing testosterone levels.
Yeah, it's actually very interesting. So what actually happens with these is not so much that they act directly like an estrogen, but although they do have estrogenic types of properties, but it's when a baby is developing and the ovaries are developing, when you expose the ovaries to something unusual from the environment, it just disrupts the way that the ovary actually develops. And what we know in PCOS is that the ovary doesn't go through its full and normal development at puberty. It kind of gets stuck in a state where too many androgens are produced, because this is actually a normal state temporarily. But in PCOS, it's like it gets stuck. And we think that the endocrine disruptors actually cause the blockage of really the development of the ovary, amongst other things.
Interesting. And is that correlated with the development of these cysts?
Yeah, so the cysts it's quite interesting because although it's called polycystic ovary syndrome, the cysts aren't actually real ovarian cysts. They're just eggs that haven't fully, gone through the development process, so they kind of get stuck. And so the follicles around the eggs they have abnormal structure, and they make too much testosterone. And because of that, it inhibits them from getting ovulated on time, and they just sort of accumulate. So it makes the ovary look cystic, but they're actually just a whole bunch of eggs that haven't ovulated.
Oh, interesting. Interesting. You write that inflammation is the main underlying factor in PCOS. And of course, we've been learning that inflammation is one of the main factors in so many different chronic diseases, heart disease, et cetera, et cetera. What are some of the best ways to reduce inflammation?
That's a great question. So inflammation in PCOS is very much typically metabolic inflammation. So we're looking at the inflammation that comes really from fat cells, especially abdominal fat. So the type of fat that's around our liver. So obviously, like the best way to deal with that is to reduce insulin resistance, because that is what causes us to gain weight around the abdomen. And so diet is definitely like the most important thing that you can do for this specific kind of inflammation. There are also, many other things that you can do, which include, for example, exercise is anti-inflammatory. Hot and cold therapies can be anti-inflammatory. And there's many different supplements that are anti-inflammatory. So high EPA fish oils or antioxidants like grapeseed extract or resveratrol. So there's all of those elements too. So of course, like no supplement is really going to make up for a poor diet. So it's always those cornerstones first, and then the supplements can definitely help as well.
So when it comes to insulin resistance, what type of diet do you think is optimal? Today, there's a big emphasis on low carb diets, and we have ketogenic diet being utilized more. What is your take on diets for insulin resistance?
So I feel that women who have PCOS are a little bit different in that they often have other hormonal imbalances. So they often have thyroid conditions or problems with their adrenals. So they're the types of diets that tend to work well for them are not often the typical diets that might work well for other people. But if we think about what insulin resistance is, it's that we're secreting too much insulin at all the wrong times. So normally we're supposed to make insulin when we eat, and it's supposed to go down in between the meals. So what I really like to focus on is creating meals that really balance the blood sugar. So starting off with a protein, a source of protein, then, a lot of vegetables, non-starchy vegetables to add fiber, and then a source of healthy fat, so something like avocado or nuts or seeds. And then the carbohydrates that I typically recommend would be in the morning, a lower carb breakfast, so something like berries along with those other components of the meal, a little bit more at lunch, and more of the carbs with the dinner. And I often recommend not to snack in between the meals. And the reason that we have the lower carb breakfast is not to spike the insulin first thing in the morning. But having those solid meals keeps the blood sugar stable, so there's no tendency to eat or snack or feel that you have to raise your blood sugar by having carbs. And it just breaks the pattern and allows the blood sugar to, be very stable, and then the insulin to come down in between the meals. And then I always recommend women stop eating 3 hours before bedtime, or even earlier if possible, and leave that nice long window without eating overnight so that the insulin can come down. And that's usually like a 12-hour window is really helpful to do that.
Now, some people recommend shorter spans, like snacks in between, so that you have something to keep your blood sugar stable every, say, 2 or 3 hours during the day.
Mm-hmm. So yeah, that is one of the methods that works for some people, but most women with PCOS, it does not work very well for them. Because what happens is every time they eat in between the meals, they actually raise their insulin again. And we're trying to train the cells to be more sensitive to insulin. And so when we just create those really solid meals with quality food, really stabilizing impacts on blood sugar, there's no real need to eat in between. So we often see a lot of women, they just stop having to snack and their insulin levels just become more normal.
So what kinds of carbs do you recommend for lunch and dinner?
So typically I like to recommend root vegetables. They're great. They're very nutritious. So sweet potatoes or squash are fantastic. Quinoa is also a really good carb. It has a lot of many different vitamins and minerals in it. So these would be my general top choices, I think. The other thing I like to recommend, I like to recommend usually resistant starch with dinner because it really stabilizes the blood sugar. So you can get that by cooking and cooling potato and then eating it. And this actually causes all the starch to crystallize and it keeps the blood sugar very stable.
Interesting. What about legumes?
Legumes. So I think legumes are actually quite nutritious. They have a lot of beneficial nutrients in them. They have a lot of very beneficial starch and carbs. A lot of times people think of them as a protein, but they're actually combined carb and protein. Some people don't tolerate legumes very well, and they might have issues with their microbiome. If that's the case, they might have to be a little more careful with them or take an enzyme to make sure that they're actually digesting them properly. And then I usually recommend that people don't eat them with every single meal because they can contain components that can bind up different minerals and vitamins. But I think
the dreaded lectins.
The lectins, yeah. So, but I do think that we see in all of our population studies that eating them is associated with very good health benefits. So I think if they're incorporated for the right person here and there, I think they're actually quite helpful.
Good. So it's common for practitioners to recommend the glycemic index for helping to balance blood sugar, but I understand you're using a different strategy. Can you tell us what that strategy is?
Yeah, absolutely. So I guess, the most important thing is the structuring of the meals. But then I use something called the food insulin demand, which is a metric that was actually developed by the same researchers that developed the glycemic index at the University of Sydney. And what they found was that as they were testing type 1 diabetics who actually have to inject insulin after every meal because they don't make any, they were finding that looking at the glycemic index wasn't really predicting how much insulin they needed to inject. And they were like, well, what's going on with that? So the glycemic index only includes carbs. So that's a limitation of that. And what we know now is that there are other components of what we eat that affect our insulin other than carbs. So the proteins, but especially the type of amino acids that's in the protein that we're eating. And for example, dairy proteins is extremely stimulating to insulin, which is why a lot of people who are weight training, they use whey protein, in proximity to the workout, because it raises insulin, which drives those amino acids into their muscles. Now, if you're waking up for breakfast and you're not you're not weight training, you're not a bodybuilder, and you're drinking a big whey protein shake or a big yogurt, you're going to drive your insulin up. So that's the metric I tend to use. We know the food insulin demand of many different foods now, and even combinations of foods. So I usually recommend a certain food insulin demand of protein, healthy fats, non-starchy veggies, and carbs for each meal.
What if whey protein stimulates insulin so much? What's a better source of protein for those who want to use a protein powder supplement?
Yeah, so I mean, I think whey protein is totally fine if the person is not sensitive to it, and if they're working out and actually going to, have that enter their muscles.
But let's say this is somebody with insulin sensitivity, blood sugar problems.
So I would usually recommend the vegan types of protein that are out there. They do have different kinds of amino acids, so they're actually not as stimulating to insulin. So there's a lot of really good ones. Just check the label and make sure there's no, that the amount of sugar is low, the grams of sugar, because a lot of them do hide sugar in these shakes.
Okay. So let's see. High androgen levels are a major factor in PCOS, and they tend to result in facial hair and acne, male pattern baldness, infertility. What are some of the most effective natural herbs and supplements to lower androgenic hormones in women?
Yeah, there are actually quite a few that we know of. And I guess the first and most important thing to consider is that the insulin causes women to make the testosterone. So any way that you can work on that first, you're going to get way more benefits from what you're doing.
Always start with diet first. Absolutely.
Exactly. But then looking at some of the supplements that you can take or herbs. So one of the ones that we have a good amount of research on is actually spearmint. So spearmint actually has been found to reduce the hair growth that a lot of women with PCOS have on their chin or their face. And it has a lot of antioxidants, but it's also an anti-androgen in women. So this is actually something, that's really easy to incorporate, for example, as a tea. And most of the studies are in 3 cups a day. And I usually suggest that you just put all 3 tea bags into one big cup and drink it all at once. Just to make it easy. So that's one option. There are some other herbs that are anti-androgenic. There is, for example, saw palmetto, which is often something that we see used for prostate conditions, but it does have the effect of lowering DHT, which is a very strong androgen that tends to cause hair loss amongst other unpleasant types of issues. And then some of the other supplements that lower testosterone work a little bit indirectly, but for example, N-acetylcysteine, which is an antioxidant, there's quite a bit of research only in women with PCOS, however, showing it lowers testosterone. It wouldn't do that in men. But
is there anything that NAC can't help with? This is one of the most amazing supplements ever. Every topic I research, NAC seems to have benefits for.
It's so true. It's one of my favorite supplements just because it works so well for so much. And glutathione is such an important antioxidant for our cells in general.
Cool. I'm sorry to cut you off there.
No.
So you mentioned in your book Anti-Mullerian Hormone. I think for sure most patients and quite a number of practitioners are probably not aware of what this is. Could you talk about it for a minute and what role it plays in PCOS?
Sure. So anti-Mullerian hormone, it's a hormone that's secreted by the ovary, and it's not something we've been able to test until maybe the past decade or so. It's primarily been used to test a woman's ovarian reserve, so just as a marker of how many eggs she has left in her ovary. And what they noticed was that women with PCOS tend to have very high levels of this hormone. This is always related to age, so there are different ranges for different ages, but in PCOS, what they found is that the ovary secretes more of this hormone than is related to the number of eggs. So it's like a functional marker. And as women's, PCOS gets better, this level actually lowers and becomes more normal. And a study was recently released showing that even in utero, women with PCOS secrete high levels of AMH, and that this may also be one of the endocrine disruptors that's involved in the development of the condition because it can affect the brain.
So do you monitor that hormone as a marker for how they're progressing in managing their PCOS?
Yes, I do. Absolutely. And it's also another marker. Sometimes it can be hard to see PCOS in lab tests because it changes at different times in the lifespan. And the serum testing for testosterone, it's not very accurate in women. So a lot of women, their testosterone looks normal, but yet it's actually high. They have a lot of the symptoms. And it's just that the marker itself isn't very sensitive. So AMH is another marker that is quite sensitive. So we do consistently see that it's higher in women with this condition. So it's great for diagnostics if I'm unsure.
What is the best way to measure testosterone levels in women?
So I prefer generally to look at other androgens unless the PCOS is very severe, because most of the time the serum levels do look normal. There are urinary metabolites which do tend to be a little bit more sensitive. So I'll run some of those urinary hormone metabolite tests. Another marker,
like a 24-hour urine, or do you do the dried urine?
Yeah, I usually do the dried urine, the Dutch test. So that's definitely one of the more common tests that we do. And the great thing with that is it picks out a lot of different testosterone metabolites, different types of androgens from either the adrenal or the ovary. And like a lot of research shows that a lot of these hormones actually that are androgenic come out of the adrenal glands. So that test gives us a little bit more information. Androstenedione is one in the blood that I do a lot because it does tend to be a little bit more of a sensitive test. And some women also have high DHEA levels, but not all. So it depends. There are certain women with PCOS that will come up as an issue as well.
So if you were to just name maybe the top 5 lab markers that you like to use for PCOS, what would those be?
So I would definitely often do a cycle day 2 or 3 FSH and LH, so follicle stimulating hormone and luteinizing hormone. We would tend to see that the luteinizing hormone is higher. And without PCOS, it would be the opposite. Typically, the FSH is higher than the LH. So that's one I do quite a lot. I always test for insulin resistance. So I tend to do a 2-hour glucose insulin challenge, which is similar to the glucose tolerance test, but we check insulin at every marker. So the person has 75 grams of glucose, and then we check them fasting at their insulin and glucose, and then we check them every half hour, and we see, how high did their insulin go? You can really see huge differences with that. Anti-Mullerian hormone is definitely one that I test quite frequently. And I often test CRP, so high sensitivity CRP, to look for inflammation. So that's definitely one. And then I'll try to look for androgens as well. So either androstenedione or looking at DHEAS. So I'll choose some different androgens depending on the presentation. Sometimes if it's hair, I'll test DHT. So if the woman's losing a lot of hair, I'll go right for that, because that's definitely one of the ones that has the biggest effect on hair loss.
Okay, cool. And you test that with serum or with urine?
Yep, serum usually. You can see that in urine as well, though.
Okay. With respect to PCOS and infertility, I know this is a huge topic, but and we could probably talk about it for a while. But can you talk a little bit about it? And then I when I was looking at your book, I noticed that one of the supplements you mentioned was this myo-inositol D-chiroinositol supplement. But so can you talk about infertility a little bit?
Oh, sure. So, PCOS is the number one cause of ovulatory infertility, which is definitely a huge cause of infertility. But regardless of that, I don't like to think of it as an infertility type of condition, because usually women are just less fertile because they're not ovulating at the right time. They have too much inflammation that can affect egg quality and implantation. But it's really something that's quite treatable. So the vast majority of women with PCOS will get pregnant. Just takes a little bit longer, and they have to work on it. And one of those, ways to work on it is absolutely with inositol, which is probably the most researched supplement for PCOS in general. So when we're looking at the ovary and good quality eggs, they have a lot of myo-inositol inside of them. And myo-inositol works as a messenger for insulin. So when insulin, it attaches to the cell's receptor, inositol is the one that takes the message inside the cell. And the inositols are really involved in so many different processes, but we've seen in studies over and over again that using inositol can improve egg quality, it can improve ovulation rates, it can improve insulin sensitivity. So even for women not trying to conceive who have PCOS, inositol is still helpful, but especially if they're trying to conceive, it has that added benefit for egg quality too.
Cool. And I know we have used a product that contains both of those, myo-inositol and D-chiroinositol. I actually just checked the label, and they didn't say exactly what the ratio was, but I guess the ratio is really important. Isn't that right?
It seems that the physiologic ratio of 40:1 is the best with respect to looking at seeing the most impacts for both egg quality and insulin sensitivity. We do know that if a woman takes a high amount of D-chiroinositol, that it seems to actually have a negative effect on embryo quality. So we know that this 40:1 ratio is very good for both fertility and also for insulin sensitivity. Or myo-inositol alone is also okay. But that combo seems to be particularly powerful. And it's actually the same ratio that's in our bloodstream.
Cool. Is the Designs for Health product, are you familiar with that one? Does that have that ratio?
I am not sure because it's proprietary,
Okay.
so I don't know what the ratio is in there actually. But
yeah, they didn't say, but I looked at their technical literature, and they do talk about the fact that the D-chiro shouldn't be too high.
Yeah, so it may be okay. The one I tend to use a lot is Ovasitol by Theralogics.
Oh, okay.
So they have the 40:1, and then they have individual pouches, which are really convenient. So
okay.
A lot of patients just pop those into their bag and bring them with them. It's really a really good product. But I love Designs for Health, and I use lots of their products as well.
Great. So I think that's all the questions that I have prepared today. Are there any other things you'd like to tell our listeners about PCOS?
Well, yeah, I mean, it does affect 1 in, 10 to 15 women. And there's about 50% of women going around with this that don't know that they have it. They're suffering. I remember in my case, I had cystic acne, which was super severe and all kinds of issues, and nobody really ever looked into that for me. So if you have any of those symptoms, go ask for a workup, and, definitely educate yourself, because a lot of the times many doctors don't really understand that PCOS is a very big spectrum of different issues. So if you feel something's up with your hormones, try and seek out, a functional medicine practitioner who can really get a good look at and get some of these tests done for you so that you can really understand if that's what's going on.
I think it's really important. You pointed out some of the subtleties of the lab markers, because I've seen other patients who went to see typical practitioner, a conventional doctor, and they ran like serum testosterone and maybe hemoglobin A1C, and they say everything's fine. So I guess, it's really important to be a little more detailed in looking at some of these markers more carefully.
Oh, totally. Yeah. I get lots of women coming in and saying, oh, my A1C and my fasting glucose are normal, so I'm not insulin resistant. Meanwhile, they're carrying like all their weight around their stomach. They're not able to lose weight no matter what they do. So it's just the wrong tests are being done a lot. So I think, make sure and educate yourself and find someone who does functional medicine, because they're going to be able to help you with these things.
That's great. Getting the right testing done is so important. How can viewers and listeners get a hold of you and contact you? And I understand you have some programs out there that are available.
Yeah, absolutely. So my website is drfionand.com. I have a PCOS quiz there, a lab test guide, so feel free to hop over and grab those. And I have an online nutrition program called Eating for PCOS, which if you head to that website, you'll be able to find me there. And then I have a clinic in Toronto, which the website for that is whitelotusclinic.ca.
That's great. Thank you, Fiona. You, in a very short amount of time, shared a lot of really good, interesting, clinically useful information.
Thank you so much for having me on your show, Dr. Weitz. It's been great.
Sounds good.